Hello, everyone. I am Dr. Steve Johnson, and welcome to Integrating REBT and Suprarational Encounters in Psychotherapy. I'm really glad you're here for a lot of reasons. Right now, I want to explore a topic that often feels unspeakable in psychotherapy training, in psychotherapy training spaces of all kinds. But it is very much alive within the psychotherapy room. We're going to talk about how rational emotive behavioral therapy, one of the most rigorous and empirically grounded approaches in psychotherapy, can coexist with and even be strengthened by suprarational human encounters. I know that sounds amazing, but by suprarational, I mean experiences that go beyond logic, but however, without being anti-logic. Experiences such as the belief that there's an answer to prayer, moments of awe in nature, profound peace in sacred or beautiful spaces, or feeling held, embraced, or accompanied after the death of a loved one, or moments when clients say, I don't know how to explain this, but something within me shifted. If you're a clinician, a coach, educator like myself, or student who has wondered, what do I do with this without dismissing it or turning it into theology? You're in the right place. Today is not about converting anyone. It's not about endorsing metaphysics, and it's definitely not about abandoning REBT. It's about how we think, respond, and remain therapeutically grounded when clients bring meaning-laden encounters into the psychotherapy room. Let me start by naming the tension. REBT is often seen as rational, disputational, cognitive, and fiercely opposed to magical thinking. And in many ways, that reputation is earned and deserved. At the same time, real human beings, not just diagnostic categories, come into therapy. And human beings have encounters that don't always fit neatly into the ABC model diagrams, belief labels, or even disputation scripts. So the question isn't, are these experiences true? The therapeutic question is, how do these experiences function in the client's emotional life, meaning system, and in their behavior? REBT was never about eliminating depth in life. It was about eliminating self-defeating absolutism. That distinction matters. Let's ground ourselves in REBT first. REBT distinguishes between events, sometimes what we call the A or activating event, beliefs, the B within the ABC model, and emotional and behavioral consequences, what REBT calls the C. What REBT does not do is dictate the content of meaning. And that's very important. It examines the structure of belief. A client may believe, I experience peace while praying. That belief alone is not irrational. REBT asks, is it rigid? Is it extreme? Is it self or other damning? Does it demand certainty, control, or guarantees? For example, This experience proves I will never suffer again. That is problematic. Because I didn't have this experience, I am abandoned or defective. Again, that's problematic. This experience means I must always feel this way. Definitely problematic. But this experience was meaningful and comforting to me. Well, that is not something REBT needs to attack. In fact, USA, or unconditional self-acceptance, allows for meaning without any self-rating whatsoever. So what do I mean by suprarational? I don't mean irrational. I don't mean anti-scientific. And I definitely don't mean mystical inflation. Suprarational refers to human encounters that exceed propositional explanation, but still shape emotion, values, and even identity. Think of this: standing before something vast, being unexpectedly comforted, feeling deep peace without explanation, or sensing connection that reorganizes one's priorities. Philosophically, these are encounter-based experiences, not belief claims. Clinically, they often, soften rigid demands, increase tolerance of uncertainty, and promote humility rather than exaggerated grandiosity. That's important. When these experiences reduce absolutism, they are often therapeutically very helpful, or they can be. Let's be clear about boundaries here, however. Suprarational integration is not validating delusions in any way. It's not about reinforcing dependency or bypassing grief or suspending clinical judgment. If a client says, "This experience means I no longer need treatment," we slow that down. If a client says, "God told me I am superior or chosen," we explore function, not affirm content. REBT is exceptionally well suited here because it challenges grandiosity, rejects conditional worth, and resists absolutist certainty of any form. Suprarational does not mean uncritical. It doesn't mean uncritical at all. Let me give you an example. Let's say a client describes standing at the ocean, overwhelmed by awe and feeling very small, but at peace. An REBT consistent response is not, "That was just a cognitive distortion," nor is it, "That proves a metaphysical truth." Instead, we might say, "Let's explore what changed in you during that moment." Often we find decreased demand for control, increased acceptance of uncertainty, softened self-judgment, and increased frustration tolerance. In REBT language, rigid demands loosen, awfulizing decreases, self-downing quiets. That's not a threat to REBT. That's REBT at work through an encounter. Another example, a client grieving the loss of a loved one says, "I felt them with me. I felt comforted." The therapeutic task is not to confirm or deny metaphysics. The task is to ask, did this reduce despair? Did it allow grief rather than avoidance? Did it support acceptance without denial? REBT allows grief. It challenges despair, not sorrow. A suprarational experience that supports healthy grief is often aligned with REBT principles. There's no problem. Prayer is another area many of us clinicians can get anxious about. And that's understandable. Some clients say things like, I prayed and something shifted. Others say, I prayed and nothing happened. Both can become irrationally framed. REBT helps clients examine demands placed on prayer, conditional worth attached to outcomes, self-blame or cosmic blame, but it does not require dismissing prayer itself. A prayer experience that leads to greater acceptance, reduce catastrophic thinking, awfulizing, and increased values consistent action is often emotionally adaptive, regardless of the explanatory framework. Now, let's consider the therapist inner stance. This part matters very deeply. The therapist's task is not interpretation. It's presence with discernment. We remain grounded, avoid over-spiritualizing, avoid trying to debunk the experience, and stay curious about the function of the experience. A good internal question is, how is this experiencing operating in the client's belief system? Not, do I agree with this? REBT is about emotional consequences, not metaphysical arbitration. There are two mistakes clinicians often make. First is reductionism, explaining away meaning until clients feel unseen. Second, inflation, treating encounters as proof or destiny or authority of some major sort. Our REBT offers a middle path, meaning without demand, experience without absolutism, depth without dogma. Clients today are searching for meaning. We are often, exhausted by the polarities that we see and experience in life, and wary of being pathologized for having depth in our experiences. Integrating suprarational encounters responsibly allows us to do several things that are important. Honor the human experience, honor our client's experience, preserve scientific integrity, and avoid splitting reason from reverence. This is not a softening of REBT. It's a maturation of its application. I want to end this short presentation with this thought. REBT never asked us to shrink the human experience. It asked us to liberate people from tyranny, especially the tyranny of demands. Sometimes liberation comes through disputation. Sometimes it comes through encounter. Our task is not to choose one, but to know when and how each serves psychological freedom. Thank you so much for spending this short amount of time with me. If it resonated, please stay curious, not only about beliefs, but about the moments that quietly reshape them. Thanks so much, and just have a great day. And I hope you join me in some other presentations. Bye-bye.